The Colorado family is getting $24 million after one of their loved ones died from stem cell injections at a Seattle clinic.
I would like to talk to you about stem cells and what are they? Are they really a scam or not? Should you do them? Should you even think about it? Hi, I'm Dr. Kate D, and I have an update today on the stem cell therapy scandal that broke out back in 2023 here in Seattle. And I wrote about this in my book. There was a doctor who founded a stem cell clinic that was offering stem cell therapy for a variety of different ailments. She was selling it basically as a cure or a treatment for all these different ailments such as ALS and Parkinson's disease and other diseases. And this was a huge scandal because back when COVID hit, she started selling the same stem cell therapy as a cure for COVID. And so she finally got investigated by the Attorney General of Washington State. And in 2022, she was fined $500,000 for making these false claims about stem cells. In the news today, the headline is Family of Colorado Man who died after stem cell injection in Seattle was awarded $24 million. This is brand new as of today. King County jury on Thursday awarded $24 million to the family of a Colorado man who died after receiving stem cell injection at a Seattle clinic in 2019. Michael Trujillo, 62, of Westminster, Colorado, died after receiving a spinal injection at the Seattle Stem Cell Center in April 2019. Evidence presented at trial showed the clinic performed the procedure without imaging guidance while Trujillo was taking blood thinning medication, and this caused his brain to swell, and he died. I believe that Dr. Tammy Moralia, according to the article, is planning to appeal. We believe there are significant issues for appellate review, according to her and her lawyer, and we intend to pursue an appeal promptly. She insisted to the news people, this is from the article, that she had not seen the patient and that the procedure was performed by a different doctor who worked at the Seattle Stem Cell Center, and that she also said she was not consulted on the treatment before it was performed. Initially, she said the plan was to use an IV for the procedure. However, the doctor who performed the procedure changed it to an epidural, which means an injection around the spinal cord, while the patient was on a blood thinner with high blood pressure. And the patient was an electrician diagnosed with ALS in 2017, which you probably know is a degenerative neurologic disorder that is fatal. It's also known as Lou Gehrig's disease, after the famous baseball player. He came to Seattle hoping that this was going to cure him, and instead he died. So interestingly, in the news, they report, this is the news report from today, it says that this doctor was previously hit with an $800,000 judgment. I can't find that actually. The original announcement said it was a $500,000 judgment. I'm not really sure which one it is, but in any event, she was found to be, advertising a medical cure to things that had no data behind it. So that's the latest $24 million judgment against her by a jury. I'm sure it will be appealed. I'm going to explain to you what stem cells are, okay, and why they're exciting, but also why there really is no data that you should be putting stem cells into you. So let's get into that. First of all, what's a stem cell? So as you probably know, you're an adult human. You have lots of different cells. They develop into a particular kind of cell, like a skin cell or a liver cell or a brain cell, a neuron. And those cells cannot change into another kind of cell. They are differentiated. They have one job. That's all they have. And they most cells can't regenerate themselves. Okay. What a stem cell is a cell that can go on to become multiple different other possible cells, depending on what stimulation happens to that cell. So for instance, when an egg is fertilized by a sperm and forms a brand new embryo, those resulting cells can now become any other cell in the whole body. They will go on to, some of them will divide and eventually become liver cells, kidney cells, heart cells, muscle cells, etc. Okay. Those cells that can become absolutely any other kind of cell, Those are stem cells, and those are called pluripotent, meaning they can become anything, right? Now, there are lots of stem cells in the fetus, in utero, right? But once you're born, okay, you don't have that many left, okay? For the most part, we think of stem cells being in your bone marrow, okay? The stem cells in the bone marrow are not pluripotent, but they can become multiple different other kinds of blood cells. So they can become red blood cells. They can become white blood cells. They can become all the other little cells that circulate in the blood. Okay. And so that kind of stem cell is what we think of when you hear stem cell transplant, let's say for a cancer, right? Those, for instance, if you had leukemia, which is a cancer essentially of your blood cells, your white blood cells, they're growing too much, they're potentially threatening your life. What you can do then, okay, is find stem cells from a compatible donor. You can kill off all your bone marrow with radiation, okay? So now you don't have any more bone marrow left. Very dangerous thing to do because you now have no immunity. But if you replace it with new stem cells from someone else who doesn't have leukemia, and that grows, that takes step shop in your bone marrow, replaces all your bone marrow, and replaces all your blood cells with good, nice, healthy cells, no more leukemia. That's what we think of as a stem cell transplant. Are those cells able to become new neurons in your brain? No, they're not. So you can't use those as a cure for, say, Parkinson's or something like that. Okay. So what stem cells are we talking about here? Okay. That people are using to cure or to attempt to cure other diseases? Well, there are not a lot of options. Okay. So if you really want a pluripotent cell that can become anything, you need a donated embryo. Well, as far as I know, that's not legal in the United States. So where else can you get them? You can get them from donated placentas that, maybe the person who just had a baby, they're going to throw out the placenta. The person donates the placenta. You can take the blood from the umbilical cord and harvest the stem cells from there. And there are manufacturing facilities creating those stem cells right now. And those stem cells are being used for all kinds of experimental things. We would love to be able to use stem cells in order to cure disease. And there's a lot of research going on. People talk about stem cells in your fat. Those are very limited. There's not a lot, and they can't become just any cell. They also talk about other kinds of stem cells that really, without getting too deep into the weeds here, right? The goal is to take this pluripotent cell that could become anything, put it somewhere under the right conditions that it could actually cure disease or help fix a problem. So for instance, one of the areas of experimentation that is going on right now is for joints, kind of like back in the 70s when we first started using PRP or platelet-rich plasma to help the joints. There was no studies back then. We were just kind of hoping putting growth factors in there would help. And then eventually, decades later, there were studies that showed, yes, it did help. Actually, recently, in the last couple of years, became an accepted treatment to treat arthritis of the joints, mostly to treat symptoms and then stave off knee replacement, for example. Stem cells are currently being investigated in a similar way to try to treat all kinds of things, but is not there yet. And it hasn't come anywhere close to being able to cure anything really. So it's all very, very experimental. If you are interested in pursuing an experimental treatment for something that's just, you've exhausted all possibilities, right? There's nothing else to try. It might be reasonable to try stem cell therapy. I highly recommend you do it within a randomized controlled trial so we can get data out of it and we can know whether that stem cell treatment actually was effective. So going to a, private office that is doing experimental treatments and charging money for it and selling it to you as though there were data to show, yep, this is going to work, or this works in a certain amount of time or patients, that is just false. That is not, our science is not there yet. Okay. So as much as I would love it to be there, it is not there. So anyone selling you a cure for things that are incurable and they're taking lots of money. This clinic was charging many, many thousands of dollars for each treatment and giving people false hope that there was a cure for things that there isn't a cure for. And I don't want to be like, so if you've been listening to the show, you know I've got stories for days about what goes on in med spas. I finally put them all in a book. It's called Medspa Mayhem. I wrote it because I got tired of hearing about people getting hurt by providers who have no business holding a syringe. You'll read about real patients, real nightmares, but more importantly, you'll know exactly what to look for when you walk into any med spa and what questions to ask. It's part expose, part survival guide, and it might just save your life. Medspa Mayhem will leave you informed, entertained, and a little shocked at what's really going on behind the business of the aesthetics industry. The link is in the episode description. Read it before you book your next appointment, because beauty should never come at the cost of your safety. Party pooper here, and I'm very interested in cutting edge research and very interested in curing these diseases that have taken, our loved ones. And both my parents died of degenerative neurologic diseases. I would love to have had an experimental treatment that actually could have saved them. So I just encourage you, avoid those kinds of scams, avoid any place that guarantees that its therapy is going to fix an unfixable problem or something you've been told has no more treatments. I'm not saying that it's not important to pursue every possible avenue. It absolutely is. But please consider not taking all your money and giving it to someone like that who is selling you a false hope. If you found this helpful, do me a favor and share it with a friend who's considering any aesthetic treatments. Subscribe so you don't miss the next one. And drop a comment telling me your biggest takeaway. I actually read them all. Let's keep each other safe and elevate the standards in the med spa industry.